Hello, everyone, and welcome to this week's Gut Check. I am your host, Alyssa Simpson, gut health dietitian and functional nutritionist, and I help people finally get to the root cause of what's causing their digestive symptoms so that you can feel good in your body, feel good in your digestion without prolonged diet restriction. So today we're talking about bloating, one of the most common problems that I see with patients and why common fixes don't actually work. In fact, many of the things we do to benefit our gut health can actually make bloating worse in certain cases, and what actually does work. So, I have some really cool tips for you guys today, and let's just dive in. So, why do common remedies for bloating often not work? Let's start with a few things people often try for bloating that don't always fix the root cause. So, one of them is cutting out trigger foods. And maybe you've eliminated foods like dairy, gluten, FODMAPs, or processed foods, processed ingredients. You're eating healthier, but you're still bloated. That's because the problem is not the food. The problem is something going on in your body. And in many cases, that has to do with stress, gut motility, or imbalances in the microbiome. And even the way we eat, how we're chewing our food, how fast or slowly we're eating, are we swallowing a lot of air, maybe eating too fast or drinking through a straw, things like that. But with food elimination, it could just be that you're looking at the bigger picture, what's underlying. So the next thing is probiotics. Probiotics can be helpful, but sometimes the issue is with your microbiome. It just depends what the issue is. And if you have bacterial overgrowth, like in the case of SIBO and dysbiosis, the wrong probiotic can actually make bloating worse. So, a couple examples, if you have histamine intolerance, a lot of the lactobacillus strains that you'll find in a lot of the over-the-counter combination products, those can trigger you. Another example would be if you have fungal overgrowth, and these might be things you don't realize you have. If you have fungal overgrowth underlying your issues, that could be then something like S. boulardii, which is out there in products like Floristore. That's a strain that can, in certain people, not everybody, trigger a yeast response. So you could get symptoms from that. The next thing a lot of people will try is digestive enzymes. And these can help some people, but if the bloating is due to other issues other than not producing enough enzymes, so if it's an issue with gut motility, food and waste not moving through quickly enough, or an imbalance of gut bacteria, enzymes alone aren't going to make a difference. And then another thing people will try is drinking more water. And this is definitely important, but drinking large amounts of water with meals can actually dilute your digestive secretions, your hydrochloric acid, your enzymes, and that can contribute to bloating because it can take longer to digest your food. Your food sits there longer, has more time to ferment and cause gas production. By the way, these four things I just mentioned, these are tools I use with my patients all the time to get them feeling better. So it's just a matter of picking the right tools for your body based on what's underlying the issue. So there's not a one size fits all for these things, but I am going to share with you some strategies to help you get relief. So the first thing is gently moving after you eat. So actually walking for 10 to 15 minutes after you eat helps stimulate digestion. It improves blood flow and nervous system signaling to the gut, which helps you digest your food. That also helps with motility. So if you're constipated, it'll help things get moving. And it helps prevent, therefore, trapped gas from lingering in your gut. It keeps the gas moving along as well. So walking can reduce those post-meal blood sugar spikes, which can also be helpful indirectly for gut function. And then if you're feeling bloated, certain yoga poses like the child's pose or cat-cow stretches or twists can also be helpful for relieving pressure. And if you're not familiar with those poses, just Google them. So it's the child's pose, the cat-cow stretches, or twists. And those can help relieve pressure and improve circulation in your digestive organs. The next thing is meal hygiene. So, how you're eating is just as important as what you're eating. So, eating too quickly or not chewing your food properly, or drinking carbonated beverages while eating. I know that one gets me. That'll be a reflux trigger for me for sure. Can all affect bloating. Making a habit of slowing down at meals. You really want to chew your food 20 to 30, maybe even 40 times if we're talking about something like a piece of steak. And that helps you break down the food properly, minimizing the work on your digestive system, and which helps reduce bloating. And so try to avoid also talking while you're chewing so that you're not mixing up air into the food. I know that's not always possible, so just keep that in mind though if you're having a lot of bloating. And then if we're out to dinner with people, we're going to be talking a little bit while we're eating. Drinking through straws, that is something you can avoid easily. And avoid gulping liquids. Try to keep mindfulness in mind. So try to eat slowly, drink slowly, avoid gulping down a bunch of air when you're swallowing. And then the next thing is stress. Stress is huge because our digestive system is directly connected to the nervous system. And I heard this morning in a podcast from a gut health psychologist that our digestive system actually could function without our brain. So I thought that was pretty crazy. But her point was that our digestive system has a lot of its own activity and produces a lot of its own neurotransmitters and signaling. One example of that is serotonin. 90% of our serotonin is produced in the gut, which has a huge effect on our mood. And also, high stress levels can interfere with digestion because they pinch off the signaling between the brain and the gut. And the brain does send signals to the gut about digestion. So when that's pinched off, because your body's in a state of stress, you're in fight or flight mode, and digestion kind of shuts down so that your body can prioritize movement and getting to safety and those types of things that may have needed to happen in a more primitive time when our threats were more physical. Taking a few deep breaths before meals is one of my favorite tips to help improve digestion and motility and therefore reduce bloating because it turns off that fight or flight mode and it gets you into rest and digest modes. Breathe deep into the belly, breathe slow, and make the out breath twice as slow as the in breath, and that will get you into the rest and digest mode. Now, let's talk about supplements because I do love supplements. I don't like loading people up with supplements. I don't like to take a whole handful of pills myself, but sometimes they are just the thing when used strategically and properly. So, if you're having bloating and it's because your motility is sluggish, so if you are not eliminating fully, that can contribute to bloating. And how do you know? You could do a transit time test. You could eat something like activated charcoal or canned beets or sesame seeds and make a note of when you swallow them and then make a note of when you see them in your stool. And if it's longer than 24 hours, that can tell us that you're sluggish. And I say this because not everyone knows that they're constipated. You could be passing stool every day, but not fully evacuating, and that can contribute to bloating from just that overall motility and sluggishness. So if this is the issue, I recommend magnesium citrate or oxide. Start with about 400 to 500 milligrams. Please check with your doctor if you have medical conditions or take medication just to make sure that's appropriate for you, as well as any of the other supplements I'm going to suggest here for this. But just this is good information for you to have. So you would start with 400 to 500 milligrams, give it a few days to see how that's going to affect your motility because it's not going to be an instant effect. It's going to take a few days. And then you can even bump up the dose a little bit if you need a little bit extra push. And that brings water into the stool, softens the stool, and really can help things slide through more easily when we're sluggish. And that can help reduce bloating. Another thing that can really be helpful is peppermint oil capsules. I recommend the enteric coated kind like IBGard. And these are known for relaxing the digestive tract muscles. So when gas is trapped in the intestines, having those muscles relax can be helpful. And my third recommendation, probably saving the best for last here, and these are my top favorites, you guys, but saving the best for last, Iberogast, Iberogast, is a blend of medicinal herbs that actually helps the stomach empty So whereas the magnesium citrate is more for large intestinal motility, so more bowel movement motility, the iberogast helps with upper GI motility. It will help your small intestine move food through and your stomach empty. So especially if you're noticing like bloating in the upper part, like maybe under your ribs, or maybe you're noticing a lot of belching, the iberogast can be very helpful. So it has many different functions, but it's especially good for bloating. And you can take it if you're having this bloating all the time, you can take it before meals, about 20 drops. Or if you're just occasionally feeling bloated after a meal, you might just take it as needed after the meal. And then if you're just chronically bloated, you could do that. And or you could do a once daily dosing at night, and that would be 60 drops. I just love iberogast. It has a really nice prokinetic effect, which is what we're talking about when we're talking about stimulating upper GI motility. So those are some actionable tips. That's the overview. Now, if bloating is persistent despite making some of these changes, it could be a sign of deeper gut imbalances. So if, for example, you're on low FODMAP, you're taking some of these supplements and you're still really bloated, that could be a sign of SIBO. In fact, persistent bloating is a hallmark symptom of SIBO. It could be low stomach acid. It could be dysbiosis, which is like having SIBO, but in the large intestine. And then pancreatic insufficiency, not producing enough pancreatic enzymes, or even food sensitivity. So that would be time to get more one-on-one help. And I do offer one-on-one services with our team, and we will do SIBO testing and sometimes stool analysis to really get to the root of what's going on with you. And then we help you balance it out and feel better. So it's really wonderful. But to get going for now, start tracking patterns, keep a food and symptom journal, and first just start collecting the information, and then you can look back and start to notice patterns. Okay, when I'm bloated, look at what you ate in the last 24 hours, not just what you ate right before you became bloated, because what you ate last night could be starting to enter your large intestine at noon the next day. So even though you ate lunch and you started to feel bloated, it's that everything's moving down the line. Your lunch is now only getting into the small intestine. If you have SIBO, that could be immediately bloating you. But if it's large intestinal dysbiosis, it could be last night's dinner now is moving, since lunch kind of got everything moving. Now it's moving into your large intestine and causing bloating. And that's called the gastrocolic reflex. It's like when everything just moves along the assembly line. Don't just guess. If bloating is severe, look at what the root cause is. Okay, guys, see you next week. Bye for now.